We're 1 minute, 15 seconds away, so you can see the conference is now live. If you haven't seen this website, you're missing out. This is where the conference is actually going to happen, and you can see that in 1 minute, what we're going to be starting is the warm-up for Teach to Reach Connect. This is where you'll get to meet participants in the plenary room, and I'm here, of course, with Charlotte Mbu and Maria Fernanda Manzan for the very first time. Is with us as part of the organizing team, but this is actually her 11th Teach to Reach, and we'll be explaining how that is possible, given the that this is officially Teach to Reach 10. All right, a warm welcome to you from Geneva, Switzerland. I'm here with Charlotte Mbu and Maria Fernanda Manzan. This time it's a trio for Teach to Reach 10. Charlotte, how are you doing? And then we'll go to Maria, who's calling in. She's going to tell you what time it is, where she is calling in from. But first, Charlotte, where are you calling from? And how are you feeling about today's Teach to Reach?
Thank you, Reda. And hello, everyone. Warm welcome to Teach to Reach 10. I am Charlotte Mbu, and I am joining from Ebolova in Cameroon. And it's a real pleasure for me to be participating at this major event. That's the largest community of health workers from around the world. And I'm really excited to listening, to reading, and to connecting with you all. Maria?
Thank you, Charlotte. Thank you, Rita. This is Maria Monzon. I'm joining from Corrientes, Argentina. It's 4 a.m. over here, but I'm very excited about being here, joining all of you, and looking forward to an amazing day at Teach to Reach. Thank you.
All right, wonderful. Thank you very much indeed, Maria. And here we go. So what's on the agenda today? Well, for that, we have to go to the conference website. And this is on the platform called Ring Central. If you go to the schedule, you'll see here. And if you don't understand what I'm doing right now or how to get there, you're in the right place. This is the warm-up, what we call the warm-up. And you'll see it'll be for 15 minutes before we go into a tutorial. How does Teach to Reach work? Unfortunately, the schedule is a little bit unwieldy. Let me see if I can. No, there's just no way to get it to display properly. So, what we're doing in this warm-up is discovering Teach to Reach. This is especially important if it's your first time. And we're going to meet some of the participants in the plenary room. I'm going to show you where that is. You can see here that it says the time and it says the stage. So where is that exactly? Well, you first need to register or sign in. I'm first going to show you. I'm just going to sign in, assuming that you've come here before. And just to show you what that looks like, this is actually my personal Gmail, and you can see you should have received a Teach to Reach Connect is starting in 59 minutes. And you've also received a message saying, Reda, do you need help? Okay. And this is actually Charlotte reaching out to everyone who just registered, asking, do you need help? There is a tutorial that you can watch here. So there's a YouTube link, and maybe we can start there. All right. Family, I'm going to show you the 3 essential steps you must complete in order to get the full benefit of meeting, networking, and learning with fellow health professionals. Now, it all starts on the Teach to Reach page, and you can see here, you scroll down to request your invitation. Here, you share your details, so put in your own name. I'm going to put in mine, and then click on request your invitation. If it's the first time you're requesting information, you'll need to first accept, click on the secure link to receive information from the Geneva Learning Foundation. You'll find this on your email. So if I go to my email now, I can see here that I have new messages from T2R, that's Teach to Reach. And the first one is how to access Teach to Reach. And so you need to click to get access. And here we're going to show you what this looks like and the practical steps to actually register on the Ring Central website. This is a service that is giving us the conference platform where you'll be able to meet, network, and learn. So on this page, you can do many different things, but I'm only going to focus on the critical step of registration. Click on Register. And now you'll see this screen loads and you have a number of options on the left. If you are an English-speaking country-based health professional, you just need to click on the first option at the top. You can ignore all the others. If you are bilingual and you're interested in connecting and learning with francophones, this is the option for you. But most of you will choose this very first option. So once it's gray here, you click on Continue. You're asked again for your first name, last name, and the email here. Click on Register. It will do some processing and then thank you for registering. The important message here is that we sent a confirmation email to the following registrants. Now, we encourage you to share on LinkedIn so you can share the fact that you're participating in Teach to Reach, but the next step also happens on email. And this is where you now see a new message. This one is from Ring Central. And if you scroll down here, you'll want to, it says, thank you for registering to Teach to Reach. The key place, the open sesame that will allow you to enter the event and participate in it is actually at the bottom of this email where you need to click on Enter Event. So let's try that. If your pop-up windows are blocked, you'll need to activate them as I just did. Here now it is authenticating, and the first thing you'll be asked to do is to complete your profile. So I will put in mine. You can put a bio about you, your company, and then add your social profile. So I'm going to do that. So you'll need to, for example, go to LinkedIn and copy your LinkedIn profile. Go to Twitter. If you don't have those things, then don't worry about it. And then we will save. If you're really in a hurry, you can skip. But because this is really about making connections, I would suggest even uploading your photo and so on. You now click on Save. And there you're in. The only thing I haven't done here, which I recommend you do, is actually upload the photo. What can you do here? The event is starting in 1 week. So actually, what you can do at this stage, you can see that the sessions are turned off, but you can see already some people have left messages. So please do introduce yourselves. So this is Reda Satki recording a tutorial for Teach to Reach participants. And here, what you can do is consult the schedule. So you can see here, June 20th, all the sessions are in English. June 21st, all the sessions are in French. So don't get confused. If you look at June 21st and suddenly you start seeing things in a different language, don't worry about it. Here, you can see that there are, you can choose items from the schedule and download the calendar invite. So you can add specific sessions to your calendar. You can also add to your own agenda by clicking on Add to My Agenda here. And you can go through here, and then once you've added to your agenda, the sessions that you've selected, actually I selected a French session here, show up in my agenda, and you can see also which sessions you're going to prioritize. Now for the event, you also have access to the People tab. So this will show you who is participating in the conference. So if I'm interested in connecting with Jonas Cabella, now Jonas hasn't filled in their profile, but I can invite him to video call, schedule a meeting, or send a message. Of course, I would recommend sending a message first before you start scheduling meetings or inviting to video calls. The part I can show you is the speed networking, and this is the heart and soul of Teach to Reach. It's the best part, and I don't want you to miss it. When you click on Join Now, of course, this is being recorded before the event, so there's no one on now, but if you click on Join, it will ask you for to confirm your audio and video settings, right? Let me see if I can do better than this. No. So, yeah. And apply to selection. So you'll select your webcam and your microphone. We recommend in general turning off the webcam. And then you will connect and you'll be connected with someone else in the conference. You'll have 5 minutes to start the discussion and you can extend the time if you want more time. So that is the heart and soul. You'll see the stage and the sessions. We'll be showing those off during the warm-up and tutorial that we'll be doing before we open Teach to Reach. So there you go. That's how you get into Teach to Reach. This is how you fully participate. Now, if you are a guest of honor or partner, you may be invited to the Zoom studio, and that is a different option. Of course, the Zoom studio is not on this Ring Central website, but you will use a special Zoom link for those cases. If you don't know what I'm talking about, if you haven't received any invitations that mention the Zoom studio, then you can safely ignore what I just said. But the main place, the best place to participate in Teach to Reach is on this ringcentral.com website. And I've just shown you the 3 critical steps that you need to go through to fully participate. All right, so that's a quick intro for anybody who manages to catch the live stream and sees the tutorial. Hopefully we can rescue a few people who really want to join. Remember, right now we are, let's go back to our schedule. Let's go back to our schedule. And you can see here we're in the warm-up for Teach to Reach. So really to discover Teach to Reach for the first time. Now we're going to turn to folks in the Zoom studio. And then we'll be doing a more explicit tutorial in about 6 minutes or so. Really to show you step by step, including how to register in Teach to Reach. Even though I've kind of already done that. We'll see. Let us know in the comments if there's a need. Let's go now for the very first time to the stage. And this is where most Teach to Reach participants are watching right now this plenary. There is a slight delay, so we can go to the comments here. So we want to wish a warm welcome to Ukamaka Okafor, who says hello everyone. Adesoji Odukoya. Iyad Omar, who says hi colleagues. Ben Rushton says hi to Maria. So he's the founder and CEO from Panadia Diagnostics. Joseph Ngugi from Muranga County, Kenya. Carrie Eller from Atlanta, Georgia, who says she's looking forward to learning from and with you today. Maybe Charlotte and Maria, we can ask for your top tips. And I'd like to start there with Maria. I'm hoping she's not busy with another urgent task. And there's a reason, Maria, why I want to turn to you. You are amongst part of the group that has participated in 11 Teach to Reach events. And can you introduce yourself and tell us, first of all, why you kept participating in Teach to Reach all over the last 3.5 years? And second, what would be your 3 top tips for folks who are participating for the very first time?
Thank you, Rita. Well, good morning, everybody. This is Monson from Argentina. Yes, indeed, this is my 11th time participating at Teach to Reach. I'm a pediatrician, so I work at a primary healthcare center, also with TGLF since this year. So top tips. Well, first, make sure your audio and is working for the networking sessions, so you can get to take advantage of that and to meet other people, which is amazing. Second, I know that we are all working and it's difficult for us to have a lot of things on our table at the same time, but this is really a day in which take advantage of all our everything that we have prepared for today. Everybody that is going to be speaking to us, that we're going to be meeting, we're going to learn from all of them, and that is really an amazing thing. And third, I would say be prepared to be surprised. There's a lot of things that you would have not thought that it would come up in such an event, but these are really let's say life-changing events. I can tell you, stories some other time when we have more time, or maybe we get to network later today, in which an experience really helps you out. So have fun and enjoy today.
All right, thank you very much indeed, Maria. And now we're going to go to Isha Goyal from India. With this question, she's also a very committed and dedicated Teach to Reach member of the community. And she is going to introduce herself and explain Teach to Reach in one sentence. Isha, are you ready?
Yes. Hi. Hi, everyone. As a very good morning, good afternoon, or good evening, as per the region from where everybody is joining. And in one sentence, I can explain Teach to Reach is a very good platform to collaborate with each other and to learn with each other. And it's interesting to know the experiences from different countries and to apply them in our area so that we can also improve the work in our areas.
Amazing. Thank you, Isha. And can you tell us a little bit more about yourself? How many Teach to Reach sessions have you joined? And can you think of one thing that really you took away from a session that has helped you in your daily work? Because ultimately, that's what Teach to Reach is about.
Yeah. I was able to join around 6 to 7 times. And the most important thing which I learned from here was from the Nigeria or Kenya, that how they are involving the local people and the community leaders or religious leaders for mobilization of the beneficiaries, because that is the most important step for mobilization of demotivated parents so that they can get their child vaccinated. And ultimately, vaccinating each and every child is the motto of all the people who are working for health or the vaccination platform.
All right. Thank you very much indeed, Isha Goyal. And next, we're going to full Maureen Fuen. So I believe traveling from India to Cameroon. Full Maureen, the floor is yours. Do introduce yourself and explain Teach to Reach in one sentence. And then I think Charlotte will have some questions for you.
Thank you very much, Reda. I am full Maureen Fuen from Cameroon. I serve with a faith-based healthcare organization, the Cameroon Baptist Convention Health Services. I'm the primary healthcare and humanitarian programs lead. And Teach to Reach for me in one sentence is, Teach to Reach is a place where we learn from experience. Thank you.
Wonderful, full Maureen friend. Can you tell us one thing that you learned from a previous Teach to Reach? That's question one. And question two, what are you expecting? What are you specifically most interested in learning about today?
One thing I learned, I think it was my very Teach to Reach experience, my very first. I learned from, I think it was from a Nigerian colleague, sharing how they are integrating immunization into every activity. And it was so much of an eye-opener to me that I'm intentional about it and have been doing it, and it's been producing a tremendous result. And for today, I'm expecting to learn still something new, especially looking at, because in my context now, there is a crisis, and so immunization and other things are dropping. We have outbreaks often. So I'm looking at maybe today we'll be able to learn something new on how to do it, especially in the context maybe of crisis. Maybe there's a colleague that will share an experience that will be able to help me better my assignment. Thank you.
All right. Thank you very much indeed. All right. Charlotte, I believe next we're going to hear from Ghana with pharmacist Bernard Badu-Bediako. Again, the same question. Do introduce yourself, Bernard, and then tell us if you can give us Teach to Reach in one sentence. But first, do tell us who you are and what you do.
Thank you very much. So my name is Farm Bernard Badu-Bediako. I am a District Director of Health Services with the Ghana Health Service, specifically at Amanse West District Health Directorate. So as the District Health Director, I advise the District Chief Executive on all matters relating to health, and I oversee, supervise, and ensure that all approved national health policies on both public health and clinical care are fully implemented. And for that matter, I ensure that universal health coverage is achieved within the district. Thank you very much.
Thank you, Bernard. And so if you had to sum up Teach to Reach in one sentence, can you tell us can you make it fit? Yes. What are you expecting to learn today?
Thank you very much. Teach to Reach is a global platform, and it's a great opportunity to network with other health workers working in other countries and also in country. It's also an opportunity to learn new interventions and ideas. And having learned them, it's expected that you would use them and reach out to everyone, especially my interest always is in the children under 5 when it comes to immunization, so that no child is left out. You have to reach every child. Thank you very much.
Thank you very much indeed. We heard from India, Cameroon, Ghana, many, many more countries represented in today's, we're going to hear in today's sessions. I want to take you now through today's program to give you a sense of what is going to come up, what to expect. Today we've got 10 minutes left in this tutorial. How does Teach to Reach work? So it's important to make sure that everyone can make sense of this event. There is, of course, immunization is on the agenda, as it always has since the beginning. The very first Teach to Reach conference in January 2021 took place at a very particular moment when immunization staff from all over the world were being asked by their governments to introduce this COVID-19 vaccination, a massive, unprecedented effort, and that was the occasion for the very first Teach to Reach conference. Today, the high on the agenda you're going to hear and hear and speak and tell us your experience is, of course, around the front lines of climate change, as well as many other topics that are related, such as malaria and neglected tropical diseases. So let's dig into this program. And so first of all, we're here, but you can see, and hopefully if you go to this, so this is on the Ring Central website. In 10 minutes, we'll be having a first-time event at Teach to Reach, and that is what we call the Teach to Reach Leaders and Partners Forum, championing community-driven learning and action. So this is really a pivotal moment. We open our partnership model to local organizations. We acknowledge their vital role in driving sustainable development. So you're going to hear from a few of the more than 220 leaders of organizations. We're going to share or introduce their organizations and share a story of a success that they've achieved through the work of their organization. And really, we're looking at building and recognizing and building community strengths, cultivating ownership of what happens to a community needs to be decided on by members of the community. So that is coming up in now less than 10 minutes. We're very much looking forward to that. And after that, at 10, we'll be having the opening ceremony. So this is where we're going to really cross over all of the different events that are built into this Teach to Reach, this 10th edition of Teach to Reach. So this is 10 in Geneva. If you go to the schedule on the Teach to Reach application to conference platform, you will see the exact time in your location, just as long as your computer is set in the right time zone. Again, in this, okay, and I just have to mark a pause to celebrate Chigo Ogobuike's message. Is so happy to be participating in a first Teach to Reach. Amazing. Just wanted to take a time out for that. So at the opening ceremony, this is where you're going to hear about all the issues we'll be dealing with. Whether it's the issue, say you care about climate change and health, and that's why you're here. You're also going to hear from Women Who Deliver Vaccines Collective. We're going to open Teach to Reach. Charlotte has prepared this with other women from the collective, really sharing their perspective on the intersection of climate change and immunization. We're going to unveil the Teach to Reach HPV vaccination handbook. This is the first time we've done anything like that. You'll see it's very interesting because it is a handbook grounded in the experiences that you and thousands of others shared at previous editions of Teach to Reach, really looking at what works. We'll be looking at covering the other topics, 50 years of the EPI program, and we'll be asking you the Teach to Reach questions, how you've turned learning into action, and what helps you transform learning into results, a significant moment of learning. I only have 7 minutes left. You can go see for yourself what's in the program at the opening ceremony. This is really the moment when we hope everyone will be there. We're sorry for anybody who misses it. Now, an hour later at 11 a.m. in Geneva, 11 in the morning in Geneva, check your local time. So we always have some people get confused by these different times. So here you can see this will be the main climate change and health plenary session. So we'll have Maria Nera from the World Health Organization, who was here last week for a lightning chat, join us, and we'll be hearing from you, turning to you and to our guests of honor who contributed by answering one or more Teach to Reach questions about climate and health, asking you to share your stories, your experiences, so that we can learn from each other. That will be followed by a short networking session. So we'll be taking a pause in the live stream just in order so that everyone can enjoy the networking at Teach to Reach. After that, we'll be going to the first partner showcase. So this is really about ending neglected tropical diseases. And there we'll be asking you to share, inviting you to share experiences of health professionals facing the devastating impact of NTDs like schistosomiasis, lymphatic filariasis, and onchocerciasis, and 18 others, I believe, on individuals and communities. We'll be hearing from you about the innovative strategies, what you're doing that's new and different for NTD prevention, the power of community engagement, locally led solutions, all of those that you have shared ahead of Teach to Reach. So we're really looking forward to that session. But that's not all. Right after the NTD session, we'll be talking about malaria. And there you can see, again, insights, your insights. Teach to Reach is about you. This is not about global experts coming to present. That is also very important, but that is not what we do at Teach to Reach. So here, we'll be looking at, again, asking you to share your experiences. And in the Zoom studio with us will be the guests of honor, those who took the time to answer Teach to Reach questions before that we asked in the weeks counting down to Teach to Reach. Then we have some great, amazing partner showcases with eHealth Africa and EHA clinics. So you can see that here. And that will be in the main plenary. We'll also be inviting them. They'll also be focusing on one tool that eHealth Africa has developed called LOMIS. So you'll be a digital solution to support routine immunization in Nigeria. So we'll be asking them questions about that as well. Going on, because I only have 4 minutes left. As you can see, the program is packed. We'll be going into a session, and this is where you will have to make a decision whether you want to join eHealth Africa and EHA clinics for their first workshop on the integration of primary healthcare into vaccination strategies, or you want to go and network for the second networking session on climate change and health. So networking, I'll show you. You saw briefly in the tutorial how that works. And then finally at 3 p.m. Geneva time, but the time may be different depending on where you are, we'll be having the Humanly Possible EPI at 50 plenary. I want to turn to Maria because Maria is first and foremost a primary healthcare doctor in Corrientes, Argentina. Maria, what are you expecting from this session this afternoon on the 50th anniversary of the expanded program on immunization?
Thank you, Rita. Well, I'm looking forward because this is a very important anniversary that we, everybody working in immunization or in primary health, we do celebrate it. And I'm looking forward to hearing from our guides on the side, Kate O'Brien and Sunera Gilani, that are going to be there, and listening to the experiences from all over the world, how you're dealing with challenges with new vaccine introductions. There's a lot going to be happening there. So it is going to be a pretty amazing session.
Awesome, Maria. Thank you. And then we have, so with the 3 minutes remaining, I do want to pay attention to the question from Yakaka Al-Haj Bulama, who asks about when we're going to be including a new topic, which in fact we've never discussed before at Teach to Reach. I'll come back to you with that. But first, so the last, I think this is the final, this is the final session. So it won't be in the plenary. So you won't be able to go in the Zoom studio. I'm going to show you, maybe that'll be the last thing to show you. And we'll show you again in plenary later how to get to the sessions, because for that you have to go to the Ring Central Teach to Reach website, and that'll be the Neglected Needs of Women's Health workshop with eHealth Africa and EHA clinics. So you can see some of the distinguished guests that will be leading this workshop, such as Dr. Ifa Nanya Ilodibe, Dr. Zara Isa Modibo, Sei Amao, Dr. Chito Umeni Nanwana, and Dr. Tambari Femi Oluwole. And finally, we'll finish the day with a networking session where, again, networking is the heart and soul of Teach to Reach. I'm going to show you how to navigate a little bit. So if I go all the way back up before we start the Partners and Leaders Forum, again, once you're in, you enter event. And here, there's a number of things you can do. I'm not going to be able to show you everything in 3 minutes. The first thing is you should be here. This is where you will see, this is the main stage. So this is where you'll join the main plenaries that are shown as such as the program. Okay, I love this message. Please, if I join one program, can I get, whoops, okay. Okay, and Chinwe Enechuku, a warm welcome to you. She's a registered nurse from Nigeria. Let me see if can I get a recorded version of the other programs? The programs are all interesting, please. So the answer is yes. You don't have to wait either. You can go right in. Let me just go to the Geneva Learning Foundation's YouTube channel, and that is where you'll be able to see instantly the recordings of all the sessions.